Good afternoon. Bienvenidos a todos, everyone. Welcome. I am Dr. Emma Olivera, and I will be the moderator for today's talk. And it's my pleasure to guide you through today's conversation. Thank you for joining the National Hispanic Medical Association Salud+Policy Town Hall Series, Clearing the Air on Respiratory Protection for the Latino Community. The goal of today's discussion is to prepare our members and partners for this respiratory season by exploring three critical themes. First, education, how vaccines work and how to address the misinformation that's out there. Two, access, what Latino patients are experiencing in the clinical space. And three, policy, how coverage and structural barriers shape health equity. Together, these perspectives will help us strengthen vaccine confidence and ensure more equitable protection for the communities we serve. Next slide. Before we dive in, a brief introduction to myself. As I mentioned, I'm Dr. Emma Olivera. I'm a pediatrician in the suburbs of Chicago, and I'm an assistant clinical professor for the University of Illinois College of Medicine, where I actually attended medical school. My work is focused on pediatrics and building vaccine confidence within our communities in a culturally and linguistically competent and sensitive way. I also serve on NHMA's National Immunization Advisory Committee, or NIAC, which brings together clinicians, advocates, and public health leaders to review vaccine materials, provide guidance, and ensure outreach efforts are accurate and culturally responsive. As your moderator, my role today is to guide this conversation, keep us on track, and make sure your questions are answered. A little housekeeping items. One, before we begin, all participants' microphones are muted. Please share your questions in the chat. I'll be bringing them into the Q&A portion later. And then today's webinar is being recorded. Everyone register will receive the link, and it will also be available on NHMA's website and YouTube channel. Next slide. A little bit about NHMA. The National Hispanic Medical Association is a non-profit membership association founded in 1994 in Washington, D.C. and represents more than 50,000 licensed Hispanic Latino physicians across the U.S. Our mission is to empower the Hispanic physicians to lead efforts to improve health equity in collaboration with students, residents, and community partners. Through advocacy, education, and partnerships, NHMA helps create healthier communities nationwide. I'm really passionate about this organization. And with that, let's get started. So why are we here today? As we look ahead in 2025, 2026 respiratory season, we know Latino communities continue to face, one, gaps in education due to misinformation and mistrust. Two, barriers to protection, such as insurance gaps, especially now many are losing Medicaid, limited sick leave, and language challenges. And third, policy changes. As I mentioned, Medicaid, CHIP, and other programs shape access to preventative care, and that really affects our community. That's why we've brought together today's panel to connect the science, the patient experience, and the policy landscape so we can approach this season informed and ready. Next slide. We're very fortunate to have these three distinguished panelists joining us today. Dr. Carlos O'Brien, Medical Director at Ventura County Academic Family Medicine Center and Urgent Care, bringing the perspective that what providers are seeing on the ground with Latino patients. Dr. Luis Cicea, Assistant Program Director of Internal Medicine at Advent Health Orlando, focusing on vaccine education and how providers can counter the misinformation with compassion and clarity. And finally, Dr. Arturo Vargas Bustamante, professor at UCLA, Fielding School of Public Health and faculty research director at UCLA Latino Policy and Politics Institute, providing the policy context on the Medicaid CHIP coverage and opportunities for advocacy. So we're gonna do a moderated conversation, and I'm gonna first touch base with Dr. O'Brien. Dr. O'Brien, let's begin with you. Could you share a little bit about your work in Ventura County and what you're seeing among Latino patients in urgent and primary care settings this season?
Buenas tardes todos. Thank you, Dr. Olivera. It's really a pleasure to be here with you all. My name is Dr. Carlos O'Brien Becerra, and I'm a family medicine physician. I do want to I don't have any disclosures specifically, but I do want to say that I'm speaking on my own personal time as a NIAC member and not representing the Ventura County Healthcare Agency. I've been part of this community here serving for over 17 years. And it's, Southern California, Ventura County, just north of Los Angeles County. We have a huge farm worker population. And, my passion over the years has been working with this community, specifically the migrant farm workers. Many of them are from Southern Mexico, primarily Oaxaca and Guerrero. And many of them speak not Spanish, but their indigenous language of Mixteco. And so there's been challenges there over the years of trying to provide care for this population. And it's been one of my passions to improve the health for this population, specifically with vaccines. As a resident, I helped create a yearly or a fall flu vaccine event where we would reach out to 300 families every year and make sure that they had access to vaccines. And then as a family medicine physician, taking care of these patients prenatally, being there for their deliveries, it's been an honor to serve this community. And so that's where I'm at now. My role has changed a little bit. Now I'm part of the core faculty here teaching the family medicine residents and also the medical director for our residency program, Continuity Clinic. And so I'll be speaking today primarily from the experience of what I'm seeing on the front lines of taking care of patients in our clinic.
That's great. That's what we want to hear exactly for the people listening in. I'm sure they're interested in hearing what you're seeing. What trends, I know it's early, we're in September, but we were talking earlier about seeing a lot of, as school comes back, so do the germs, right? So what trends in respiratory illnesses and vaccination rates are you currently seeing among Latino patients in your arena?
That's a great question. Yeah, it is early on, obviously in fall. We've actually seen a lot of COVID uptick, specifically the end of summer. We started seeing more of that, primarily in urgent care, where we have access to doing rapid tests as well as a fourplex, which checks for RSV, influenza A, B, and obviously COVID. And so we saw an increase that we continue to see for COVID. We have not seen yet influenza numbers really that high. Or RSV. Typically, as you know, it usually starts at the end of this month or October. But I think around the globe, specifically looking at Australia, my understanding is that they had a pretty bad flu season and they're kind of finishing their flu season. So many of us are just scared to anticipate that we're going to have a pretty bad flu season this year.
I know, I feel you on that one. But do you notice a difference between Latino patients in your community and those of the general population? As we know, Latinos often serve in essential workforce and do different types of jobs at times than the general population. Have you been seeing that when you're seeing COVID, et cetera?
Yes, I mean, I think that's something that we've definitely anecdotally seen with our patients that primarily, obviously, with all the ICE raids that we've had in our community, where people are delaying care. And so they will not be going to their preventative care visits as much as they used to because of the fear. And then, unfortunately, we've been seeing higher acuity of disease, including in our own hospital, where we're really full with the ICU because of more respiratory illnesses that people delay care in. So I don't have numbers, but I can say anecdotally, we've had definitely an increase in our acuity of care for respiratory illnesses.
Yeah, I think that really segues nicely into this next question, as that what you're explaining is a big barrier to access, right? So what are some of the biggest barriers your patients face when trying to get access to flu, RSV, COVID vaccines? You highlighted one, but can you think of some others of these barriers?
I think what we're seeing right now is really focused on what's going on in our community and the chilling effect of ice in our community. We're in the community where the glass house raids occurred of over 300 people that were arrested and one farm worker died. That's in my community. And so that has had a horrible effect in terms of affecting how people access care. And so we've had low numbers earlier on in July and as well as August in terms of coming into clinic. And I think that's been a big part of not being able to talk about vaccines in anticipation of getting them vaccinated. And, on a different level too, not everything happens in our clinic, right? I think there's plans to do outreach and bigger events like health fairs. But unfortunately, just again, with the fear of big events where there's going to be a lot of people, those big events haven't really happened because of the fear that ICE will be there as well. And then obviously the issue with access to care from health insurance. I think initially as a state in California, we've done a great deal of improvement of access to care by basically opening up enrollment for patients who are undocumented. And through the years, I've seen patients that didn't have insurance and then had insurance, and we were able to get them preventative care such as their colonoscopies. And now we're kind of going backwards, and we're seeing that it's going to be basically causing people to not have access to other preventative cares, including vaccines. It's a big fear in our community, and we're trying to collaborate and figure out how we're going to be able to still focus on providing these preventable vaccines that will prevent all these diseases from happening.
Yeah, it's a really tough time right now, and thank you for sharing that. I wanted to see if you could share a real-world example from your community where a safety net provider strategy either worked well or fell short in ensuring vaccine access. You mentioned health fairs, for example, and right now health fairs being, maybe not the strategy that we need to employ right now. Can you give another example of what you've been seeing?
Yeah, I mean, the good thing in my healthcare setting is that we're a county setting, and so we will see everyone, and we're very proud of that. It is more challenging, obviously, if we're getting cuts in our funding and budgets, but we still strive in terms of our mission to make sure that we're providing quality care for everyone, and we're very proud of that. We see homeless patients, we see patients that are county employees in the same clinic. Part of the strategy has been to still focus on vaccines by figuring out other ways to provide these vaccines. So whether we're sending them to the pharmacy to get their vaccines, or there's something called self-pay. It's a discount program that has existed for years in our county. And so in that system, our vaccines are covered. So we can still provide those vaccines. The visit is still a cost to the patient, but the vaccines are for free. And so we're excited that we continue to have these services. Hopefully it will continue because unfortunately there's been a lot of gutting to our public health department and lack of resources, including this year we don't have COVID vaccines for our patients through public health.
I think, as you mentioned, cost can be a real barrier to getting vaccines. If it's free, you're more likely to get a yes than a no. In terms of getting yeses and nos, right? What approaches have you found most effective in building trust with hesitant or underserved patients when talking about vaccines and preventative care?
Yes, I think continuity, continuity, continuity. And as you know, as a pediatrician, as a primary care physician, we need more primary care physicians to be in this role. We need more Latinos and Latinas to be in this role, to connect with families and to be that trusted physician that's going to help them make those decisions and prioritize getting themselves and their families vaccinated. And I think that Sure, there hesitancy in all populations. We see this throughout all communities. But I think the biggest takeaway has been if you continue to see that patient in the setting that you're their physician or clinician, and you continue to recommend it strongly, you will see that there will be positive change.
100%. We saw that in the pandemic, and we see that to this day. Thank you, Dr. O'Brien Becerra, for those frontline insights into patient experiences and barriers to care. Let's now turn the science and communication side of vaccine education. As you mentioned, as physicians, we are the key messengers. And so I'd like to ask Dr. Isea, our key messenger here, please tell us about your work in internal medicine and education and how it connects to helping patients better understand vaccines.
Thank you. Thank you, Emma. Thank you for the question. Thank you for the invitation as well. So as you stated, I am an academic internist. I work as an APD in Advent Health Orlando in our internal medicine residency program. And for sure, I'm a firm believer in medical education and its role in to continue shaping the future generations, right? And one of the things that we have noticed, in our program, we have a lot of international medical graduates, for example. We serve a large Hispanic community as well here in Orlando. We are in Florida, but Orlando is a very diverse city, and we serve a lot of patients. Now, I think in education or medical education has a very important role, especially over the past few years with all of the changes that are out there in public health. And it is very important to instill to all of our residents, to all of our trainees and medical students about the importance of preventative health, about the importance of public health and advocacy, why it matters, why it's not just about learning or memorizing the immunization schedule that AAP, ACIP may put out. Why is it important? Why is it more than just a care gap that we need to do for the insurance or just to basically click something on the EMR? It's about the actual impact that immunization strategies are going to have in our patient outcomes, that we are going to see this. We're going to see this reflected in hospitalization rates, in morbidity and mortality down the road. But more than that is about how can we consider, and specifically the times that we're living in, is about how can we actually discuss different strategies to overcome vaccine hesitancy, to overcome misinformation that is out there. And I see that as on one side, trying to do different workshops or modeling communication strategies, modeling patient encounters to understand what are the most common myths that the patients may actually have in regards to vaccines, and certain strategies to acknowledge those fears that the patients may have and how to go around them, or how to provide accurate, empathetic information to actually allow our patients to understand better why is it important to get a vaccine. That's on one side. And on the other one, I think it's about being there with your patient. Like Carlos mentioned, it's about follow-up, it's about consistency, it's about trust. So all of that, I think, has to be instilled, has to be part of the medicine curriculum, especially for all the primary care residencies, family medicine, internal medicine, pediatrics, OBGYN, as we are always going to be the front line that the community has in regards to public health.
100%. I feel like there's so much for everyone to read out there and access to knowledge. It's hard to know what to filter through your mind to make an educated decision. In simple terms, can you explain how vaccines like flu, RSV, COVID-19 help protect our immune system? Can you break it down?
Yeah, so very generally speaking, I will say all vaccines, what they do is try to boost our immune system response to a specific agents, to specific infectious organisms. In the case of flu, COVID, RSV, we're talking about different respiratory viruses, the influenza virus, the SARS coronavirus 2 virus, and the respiratory syncytial virus. Now, all vaccines basically what they do is try to boost that immune response. And the immune response can be mediated through antibodies or can be mediated through cells, basically, and through memory pathways that eventually what they're going to do is allow the immune system to remember the pathogen or the protein, the organism that you encounter, and down the road, if you encounter that organism again, basically the actual organism when you are in the community, the system or your immune system is already going to have that response to target it and prevent that virus from entering the cells, replicating, and actually cause disease. Now, there are different things, or two big things worth mentioning here. So there are different types of vaccines. The COVID-19 vaccine, or the most common ones, are messenger RNA vaccines. So what that does is basically it's a little piece of genetic information that goes inside of the cell and tell your immune system this is the proteins, or these are the proteins that you have to produce in order to prevent the entry replication of the COVID virus. The flu and the RSV vaccines are, let's say, more of the traditional, if we want to use quote unquote that term, of the regular adjuvated vaccine, into which you are literally providing the patient with a part of the subunits of the proteins, particularly the ones that are located in the surface of the virus, so that now the immune system produces antibodies down the road that are going to recognize those proteins. So when the patient encounters that virus, that wild type virus in the community, then those antibodies are going to go right there and try to prevent the replication of the virus. But one important thing to mention about vaccines is no vaccine is none of these vaccines is 100% effective. And that is okay. Because what matters, and that is important in the message that we have to provide to the patients, both in the COVID vaccine and the flu vaccine particularly, is that yes, the patient may end up getting an infection. That can happen, but still the immune response that you are providing to the body, that memory pathway that you're creating in the body, is going to be essential to limit down the road the growth, the replication of the virus, and all the inflammatory consequences that can happen down the road. So even if you get an infection, it is established that the infection should be milder and shouldn't lead to all of the deleterious bad consequences that can happen, particularly with all these three respiratory viruses.
Yeah, totally. How I break it down to teens is, we're constantly updating our cell phones. We need to update those immune cells as well. So annually we get our flu shot, and we get boosters for our tetanus and other vaccines. It's basically updating our cell phone and actualizing it, right? And the way I kind of tell the teens what mRNA vaccines are like, it's like Snapchat. Your body gets a picture and you remember what that picture was of, but you don't see it again, right? So we're making those immune cells based on the information that we get from the mRNA vaccine, but that vaccine doesn't stay long-term in our body. It's our immune cells that are making a response. So I think there's so many myths out there and so much misunderstanding. Can you give us the most common ones that you've encountered regarding vaccines, and how do you respond to them?
So there are a lot of myths out there. One of the most common ones is, particularly, and this is even before COVID, is that I get the flu shot, but whenever I get the flu shot, I get sick. Right, that I don't want to get the flu shot because I'm going to get sick, and I know that, and I got the worst flu of my life when I got the vaccine. So that's just one to mention there. And usually the conversation that I have with the patients is not necessarily about, that is impossible, like no, and try to be dismissive, because yes, we know on the science base that the actual product that we're in, the biologic material that you're injecting into the body, is not the actual virus, right? It's not the infectious particle. So it is, yes, impossible for the vaccine to cause the disease. But what I tend to tell the patients is, what you are getting, if you feel a little ill afterwards, is the immune response that your body is having to the actual, let's say, innocuous viral particle that you have. So that little piece of the virus that we're injecting is creating an inflammatory response, or it's creating an immune response in your body that can make you feel a little weird. Yes, it can cause a little bit of malaise, chills, some people get some mild fever. It can happen. But that is totally self-limited. That is going to go away. It doesn't happen to everybody. Even if it happened in the past for you, doesn't mean that it's going to happen again. And you can always take Tylenol, Advil, anything that you want on that side, and it's going to get better. Now, there are certain vaccines that may sometimes have a stronger reaction in that sense. I've seen that, for example, with shingles vaccines. But in any case, it's about just tell the patient it's going to be okay. Even if you have a little bit of soreness, that's going to go away, but you're actually preventing the big bad things. That is what the vaccine is designed for. So that is one of those. Other one that I get, particularly with COVID vaccine, is this vaccine is actually very bad. Like this vaccine, I've seen a lot of things in social media. This vaccine is actually causing people to die prematurely. That is going to cause like a lot of weird things, chest and myocardial infarctions, strokes, like numbness, tingling, like a whole array of symptoms. And a lot of patients actually, not necessarily at this time, maybe the conversation is not that much on that, but a couple of years ago, that was everywhere, and that was fueled by misinformation. And generally, it's about talking with the patients, just like what we do with medications as well, is, okay, tell me a little bit about your concerns. So where did you hear this? I know, well, what's happening in social media. I saw that somebody in Instagram said this, or somebody in TikTok, etc. And then it's about trust, and then usually in a very empathetic way, that, okay, I understand the concerns. There are a lot of things that can be there in social media, but remember, with this is important, or the conversation that we have around this has to be with somebody that it really belongs in the healthcare profession, that is your physician, and that's what I'm here for. So I'm your primary care doctor. We have known each other for a while. So tell me, if you have any questions, I'm here to answer those. And the medical evidence that we have is this. This is what we have seen. And we have applied this vaccine to millions of people. And even though there may be some outliers or certain tendencies in very specific things that can happen as well with other vaccines, we have not seen this widespread. And the benefit definitely is going to overcome any potential risk that we have, particularly if you belong to a high risk population. So those will be the two most common ones that I see.
I think too, as you mentioned, when you're seeing information on TikTok and social media, is finding out when that was actually posted. Because sometimes something was posted in 2020 and, might have been what was being, looked into, but now in 2025, we know better. So sometimes I ask them, bring me that article you're reading, or show me that TikTok you've seen, so I can know exactly what brought on this concern. When faced with a hesitant patient, what strategies do you recommend providers use to have compassionate and fact-based conversations around this topic?
So I remember I learned not that long ago that the importance of motivational interviewing for vaccine hesitancy, and the importance of listening empathetically. And I think that's the key here. The key is about the physician-patient relationship that you have. Is about not being dismissive. And just like what it happens with other concerns that a patient may have, but particularly this one being so rooted and right now being so fueled by misinformation, even coming from large public healthcare agencies. So more about, okay, listen, what's happening? So what is the concern that you have? A thing that I started doing a couple of years ago was, rather than necessarily opening up the encounter with, would you like to get the flu vaccine? I usually start now saying with an affirmation, today is the time to get the flu vaccine. So the difference of maybe just providing that open-ended question that some can lead to the patient saying immediately, no, you know what, I don't do that. That if you start with a positive affirmation saying, this is the day we're gonna get your flu shot, can create a difference there. And I actually have seen that in my patient encounters. So afterwards, of course, the patient may say, if the patient has real major concerns, they are gonna tell you, no, you know what, why are we doing this, etc. But if not, at least you are already starting to move the needle ahead, starting to move along with the process of providing the immunization for the patient. As I said before, listen, try to be very empathetic, understand the concerns, try not to speak over whenever the patient is saying, and if you have frustration, just keep it there, and then try to provide that. Focus on the connection that you have with your patient, particularly if it is a very well-established patient. Like, we have known each other for a while. The importance of this is about trust. Trust me, I've been using these vaccines for a long time. Most patients in my clinic get it. And we are seeing, particularly if you belong to a high-risk population, it is very important. It's essential to prevent the complications of these diseases that may be around, and provide real-world examples that you may have seen. If you work in the hospital, if you work in your clinic, things that may have happened that you have seen, either good or bad.
Yes, for example, I'll say these are the recommended vaccines that your child needs for today. Do you have questions about these vaccines? These are why we give these vaccines. And then if the answer is no, I will say, okay, well, I can give you information and how about you come back? Or in terms of the flu vaccine, I say, well, think about it. Especially right now we're in September, I can understand why maybe someone would want it delayed, but I usually say I really strongly recommend to do it now because once we're in Thanksgiving and Christmas time, we're going to see that bump, and it's better to get it now before we even experience a big wave in these infections. Um, Talking about what we see in our offices, and the big bump in Thanksgiving, etc. Could you share a success story where clear, culturally competent communication helped shift a patient's perspective on vaccination?
So I think what I remember a couple of examples, and one of those wasn't that long ago, it was just a couple of weeks ago with flu vaccine, I think a week ago. And it starts with the idea of, as I said, listening. So this is a patient that was elderly, had COPD, former smoker, so a lot of different comorbidities that put him at particular high risk for flu in this case. So I introduced the idea, okay, hey, we're gonna the flu vaccine today. Like when you go over all the immunizations, you say, today all the rest of your immunizations are looking good, but we have to update the pneumococcal vaccine and we have to provide you with the flu vaccine today. So then you can immediately see the patient's face, right? That some are like, okay, cool, yeah, excellent, sure. And some may immediately say no, and you have the ones that are in the middle. And the ones that are in the middle, I think, is a very important target that we can actually act right there in that visit and we can create a meaningful change. Because sometimes when you have the patients around the total spectrum of no, that may take a while. That may take a couple of visits. That may take, providing information. You go back and forth. But the ones that are in the middle, those are ones that you can then, when you look at the face that are like, okay, really? Then lean on a little bit more. And then that's what I did in that case. I was like, yes, definitely, it's very important. I see here you have gotten the flu vaccine in the past. Maybe it wasn't in this case last year, but you got the vaccine in the past. Everything okay? Yeah, sure. Yeah, maybe I got a little sick. Okay, so that means that things went well that time and things are going to go very well now as well. So I try to introduce a little bit of humor as well, just to try to lighten the mood a little bit and say, it's all good. I have my MA outside. She's going to get the vaccines ready. And that's just going to take 5 minutes and things are going to go well. Tell me, do you have any concerns? And generally, in these cases, sometimes they bring up the idea of misinformation and all of that. Sometimes it's about, but I'm going to go to work. I don't want to feel sick. Like I have a long shift, things like that. So in that case, I tried to say, that's okay, just take a Tylenol. So when you get home, before you're gonna go to work, if that is a real major concern that you have, take a Tylenol, take an Advil, and at least we're taking this opportunity before you go out there and then you have to go to a pharmacy, go to a CVS or any other location. We at least started here, and we're gonna forget about all of that. Anyone?
Oh yeah. And I tell like the little ones like, oh, these shots are going to give you superpowers so you can fight off any of those germs this year in school. So also, the child is getting the shot, but the parent might be, agreeing to it, but also getting the child involved is really important. What practical tips or tools can providers use to simplify explanations when they're talking about vaccines, such as any bilingual resources, when you're seeing like Latino patients, for example?
So I think for that, there are different things out there. And NHMA, particularly our organization, is working with the National Immunization Advisory Committee to put out there new bilingual materials that are focused on education, on immunization schedules, that I think those are going to be very useful. And before that, we had also a very large campaign called Vaccinate for All, that there are some materials as well that could be very valuable. If you go to other large organizations, so ACIP, even the CDC still has some infographics that can be of use. And as well, there is another one called immunize.org that is based on a partnership that they have with CDC as well, that has very good material on vaccine hesitancy. So I tend to stack some information in my office about vaccine myths, for example, and there are some of these resources out there, and I just provide one to the patient, especially when you're having that patient that wants to circle back. I provide some information. Hey, read a little bit about this, and then we'll come back and talk about this again. There are some general things about immunization schedules, about vaccine hesitancy and myths, and there are specific ones for each disease. So you find information about pneumococcal, RSV, and a lot of these actually can be obtained through professional organizations, sometimes through medical science liaisons from the vaccine companies, etc., depending on the networking that you have. But the important thing is that there is information out there. So connect, particularly in the bilingual side, in the bilingual side of things, through NHMA. You can reach out to any of us or our staff, and you're going to find information that can be of use in your practice.
Those are great. Thanks for bringing up those resources. And thank you, Dr. Isea, for breaking down the science and giving us practical strategies for patient communication. Now let's look at the policy landscape that affects access to vaccines. Dr. Bustamante, please start by sharing a little bit about your work in the public policy or health policy arena and how it intersects with Latino health equity.
Sure. Thank you very much for the invitation. And the way I can contribute to the debate so far is that so far, from the policy perspective, we are right now in an environment when state governments are going to have to make cuts on funding, particularly on Medicaid. So one of the ways that policy actors could potentially contribute to minimizing the pervasive effect of these cuts is by prioritizing cost-effective interventions such as vaccines. We also are in an environment when there's more individuals who are more hesitant to leave their homes or to go to the doctor, given the fears on the potential link between healthcare providers and immigration authorities. So it is important for providers and in both the direct providers and the administrators in the clinics to make sure that they are able to outreach to these patients who are hesitant in order for them to be able to precisely inform them about the benefits of vaccines and about the importance of getting these vaccines. So yes, it's a very complicated and right now very challenging environment, but there's some ways that some policymakers at the local and state level are looking into trying to minimize these effects. For example, the recent alliance from California, Oregon, and Washington, where state governments are trying to make sure that some of these issues with vaccines could be addressed and resolved at the state level. Unfortunately, this is only in a few states, and we still don't know if they're going to be effective. And there are other states where also many Latinos live, where many people, individuals of color, would not be able to have access to a vaccine because of the environment that they are living in. So from the policy perspective, yes, we need more action at the state and the local level. And we hope that the pervasive effects of Medicaid cuts at the state level and of potential cuts at FQHC level as well may not hamper that much the funding of vaccines and the delivery of vaccines and the administration of vaccines.
You know, Dr. O'Brien gave very helpful examples of barriers, like physical barriers to access of care. But can you explain a little bit more about how Medicaid and CHIP coverage gaps impacts vaccine access, in particular for Latino families?
Sure, because most of these cuts are going to be impacting Latino adults and children. Mainly because the states that are going to be the most affected are where the most Latinos live. And when you have cuts in funding or new requirements such as work requirements that will essentially create savings on Medicaid based on attrition, people who are not able to go 6 months after 6 months showing that they are working or volunteering, then they essentially lose their Medicaid coverage. When people lose their coverage, regardless of type of coverage, Medicaid or not, are by far less likely to access healthcare. And if people don't access healthcare, or if people don't have insurance to get the minimum, that is a vaccine, a flu vaccine every year, then they will be far less likely to get the flu vaccine or any other type of vaccine. So by cutting funding and making cost savings by reducing the number of insured individuals,
then the likelihood of getting a vaccine will go down. How much? We're still working on that. And we will have to see the data after 2026, because all these policies, most of them get into effect until 2026. So that's when we're going to start looking at the real impacts of these policies. Right now, what we're like facing right now is just the inertia from the previous years. So this year we may still see vaccines. We will still may be able to get some states when there's action to ensure that people get the vaccines. But in future years is when we're going to start to see the real consequences of all this. In the case of CalFresh, for example, that's also affecting the access to food at the household level. And many households have both Medicaid and SNAP, or in the case of California, it's CalFresh. But if both are caught, if both are subject to work requirements, and if these households that right now are able to keep day-to-day based on this support from both Medicaid and SNAP, then if they lose this type of coverage, it's going to be by far less likely for them to be able to have either the time or the money to look for vaccination. So that could also translate in like reduced vaccination rates. Or even if, let's say we send them to the pharmacy, if they don't have insurance to pay for it, they may be less willing to pay for that. And even if they, let's say, get it in a health fair, it has to be for free in order for them to be able to get it. As the first speaker mentioned, it's important for county governments to make sure that they try to make access to vaccines as universal as possible, because I think if in the US, it has been very difficult for us to make sure that healthcare is all right. At least the most cost-effective interventions, such as vaccines, should be as universal as possible. I think that the more efforts that county governments and state governments do in order for them to guarantee access to these very basic interventions should be definitely supported.
Agreed. We know you've recently worked on briefs about proposed changes on Medi-Cal and CalFresh in California. How do these serve as examples of a larger national policy challenge?
Yeah, well, California was one of the states that was the most proactive in using state funds and getting waivers in the case of Medicaid, for example, to expand coverage. California was one of the first states that expanded coverage to undocumented immigrants. And right now, that coverage is compromised by funding cuts. No? So there's like a freeze in the state, in the case of California. There's even like a cut in coverage in the state of Illinois for undocumented immigrants to age 65. So it's important for us to learn from these experiences, and states that have been the most proactive at right now have experiencing like these briefs show how the challenge that these states are going to be facing in order for them to guarantee that insurance, but even if insurance is not going to be possible for the great majority of individuals currently covered, even the basic challenge of ensuring that there's like basic health interventions such as vaccines available to everyone. So yes, if insurance is not possible, as I was mentioning, we have to prioritize access to the most basic and cost-effective interventions. And vaccines are one of those. So if we are unable to allocate more funds to Medicaid expansion, let's say, then at least the states and counties should be focusing their efforts in making sure that the most effective interventions are ensured for everyone. And one of them is vaccines.
Yes, vaccines save lives and are the #1 way to prevent long illness as well as death. How do state level decisions ripple out and shape the national picture for respiratory health equity?
So state policies are usually places where in our policy environment we innovate. Precisely one of the waivers that California received to expand Medicaid to undocumented immigrants is one of the places where we're actually learning from how it works. No? What are the positive impacts of expanding Medicaid? So we also take advantage in the US of having this diversity of policy environments in different states. So different efforts that could get implemented in different states, as long as we show that there's some type of effect, we should disseminate it so that other states can learn. And that the way our policy environment works is usually when there are successful experiences, there's like a ripple effect where essentially states start adopting it, and at some point it gets all the way to the federal government, and it shifts federal policy. So perhaps this is the time for us to start like encouraging that policy innovation in different states, either blue states or red states. It's important for us to find those innovations, try to show that they are effective, and hopefully in a few years, those cost-effective interventions are going to be materialized and translated into federal policy.
Looking ahead, what opportunities exist for advocacy? How can providers, community leaders, and organizations like NHMA push for more equitable policies?
So I think that just what we have seen in the previous two speakers, they're perfect examples of how providers, when they're very well informed and they can disseminate their best practices, can have very positive impact. By learning from others on what works or what doesn't work, can definitely help other providers address these issues. And at the advocacy level, I think we need to definitely take advantage of all the different organizations that are providing input to this policy debate in order to inform their communities, both county, state levels, perhaps at immediate time, and hopefully in the future at the federal level, so that they can provide that information that is needed in order for us to do sensitive policy.
I think one thing I like about going to the NHMA conferences, especially when it's in DC, is the fact that I can speak with my representative here in Illinois and give information on what I'm seeing with my patients. A lot of our lawmakers actually aren't in the medical arena and do rely on us and do welcome us in the healthcare field to educate them on what we're seeing. I've done that also with the American Academy of Pediatrics during Advocacy Day, where pediatricians from around the country speak with their lawmakers on what they're seeing, such as e-cigarettes and things like that. And so I would also recommend people going to the conference if they have never spoken with a lawmaker. We go as a group, and that could be one way. Educating the people who are in the decision room and in these committees is really important for us. Can you give us one takeaway you'd like our attendees to leave with about the importance of policy in shaping everyday patient care?
That we all are important in the process of policymaking. And as you were mentioning, while our individual actions count, also participating in bigger organizations, such as this organization helps in trying to persuade decision makers on what are the positive policy choices that we have to make. So I think participating should be the main key takeaway, and making sure that we are able to have an environment where we ultimately can ensure that the population gets vaccines. So that, I think, in our different roles as providers, administrators, in academia, we should make an effort to do that, to keep participating and keep informing the policy community about what are the most cost-effective ways of delivering vaccines and what are the benefits of doing this.
Exactly. I think we need to realize that we are the experts on our communities and use our voice to advocate for those communities. Thank you all so much for the thoughtful, insightful perspectives. Together, we've heard how these issues connect across the patient, provider, and policy levels. Now I want to open it up to the floor for your questions. This is a reminder to put the questions in the chat, and then we can go through some with our experts. Feel free to use the Q&A box. While we're waiting for individuals to put their questions, I think a lot of questions were answered during this talk, but I'll throw it to Dr. O'Brien. What are some ways busy clinics can still make time for vaccine conversations during short patient visits, especially when dealing with urgent needs?
This is a great question. I think, the idea of this presumptive approach, it has to be the standard of care, and it has to go from the beginning to the end of the clinic visit. So we need our medical assistants and our front office people. Everyone needs to be on board. So it's flu season, reminding the patients that's what they're here for as well, making it a priority. And I think that goes with the importance of training your staff to make sure that if we have any hesitancy ourselves, and if we're not getting our own staff vaccinated and ourselves vaccinated, our families vaccinated, how can we ask our patients to get the vaccine? So I think it's not just an individual clinician approach, it's got to be the whole clinic approach.
That's a great comment, because a lot of times, for example, patients of mine may have not gotten a vaccine that day for whatever reason, and we've deferred it to a nurse visit, and now we're in flu season. So we really need our nurse and our team to bring up, when you were here during your visit, doctor recommended these vaccines, but now we're in flu season. Do you want to add on the flu vaccine today? And so because they don't know we have the vaccine unless we tell them to. So we need everyone on board helping make those appointments the best for the patient. I want to ask Dr. Isea, we often hear from patients that they're concerned about vaccine safety, especially with newer vaccines like the RSV vaccine. What's the best way to address safety concerns while keeping the conversation open and respectful?
So I think that falls into what we talked about the COVID vaccine. It's about the trust that you have, trying to understand first, where is this patient getting its information from? And generally it's going to be either social media or an interview that they saw on TV, things of that nature, the internet somehow. And then once you listen to those concerns, maybe just start by focusing on the conversation that you have with the patient, trying to provide your assessment of what is the most accurate information regarding the vaccine, trying to debunk those myths that we spoke about before, and then providing those materials that we mentioned. So do make sure that you have either a stack of these resources in your office, or you can have even QR codes as well, that you can tell the patient, just scan this, is going to take you to Vaccinate for All, NHMA, ACIP, or any of the resources or websites that we spoke about, and just tell them, I understand that you have questions. I understand that there is a lot of misinformation out there, that you hear a lot of things, but if you're going to spend some time researching or doing some research, because that is and that's okay, that is who you are, then try to do research as well from these sites, because these sites are backed by medical evidence and a lot of different physicians and scientists that have put their efforts into putting this together.
I'm going to piggyback off of that with a question from the chat for you, Dr. Isea. What updated or reliable education material or sources do you recommend for community members and patients to read in Spanish? And can you bring up, is NHMA producing some of these materials?
That's a good question, Max. So yes, definitely. As we mentioned earlier, we put together, now there is a large advisory committee that is called National Immunization Advisory Committee, or NIAC, that met a few weeks ago. Actually, we did a revision along with the NHMA staff of very good updated educational materials, bilingual, that go over all the big things in immunization, including the schedule, what vaccines are recommended, and debunking certain myths. So those are in presence of NHMA. So that's something that definitely you can feel free to reach out to us or the staff and see how we can make sure that you get those.
And thanks for mentioning the QR code. I thought that was pretty innovative. I haven't thought about doing that, and probably my teens would like that. We have a question from Ruthie. I'm gonna throw it to you, Dr. O'Brien. With the aim to deliver quality education and resources, what approach have you seen with engaging the Hispanic Latino community in regards to research participation?
It's a challenging question, because I think that there is a lot of hesitancy to participate in research, especially if someone who is, for example, undocumented, and there's going to be more questions about their background. I think a lot of, rightly so, of our community members do not want to participate in those types of research projects. But it's unfortunate, because I think it's so important to highlight if there are healthcare disparities specifically. We need those numbers to kind of really highlight where the biggest need is as well. And I think, for us as a community, we've really tried to build relationships as the primary focus, and go through community organizations. And the example that we have is the Mixteco Indígena Community Organization Project. They have their own research basically facilitator that will evaluate to see if it is safe for community members to participate. And obviously internally through IRB as well, we have our own process to go through these things. But there's a huge need to understand better. I mean, currently there's a lack of data to define exactly the issues with access to care in regards to the ICE raids. And that's something that I think that we need to expand more on. But it's very challenging in the setting of trying to capture that data as well.
I think that's a great point. Diversity really is important when we're talking about research. And one of the greatest things about the COVID-19 vaccine is we did see a lot of diversity of participants when we have that data. So we can say, reliably how different communities may react and respond to these vaccines. I wanted to ask Dr. Vargas Bustamante, how can providers and advocates stay informed about upcoming policy changes that may affect coverage and access to vaccines?
I think that they'll probably get it from the news, but also through the academic literature. Many of my colleagues and I, we definitely have two avenues of dissemination of our work. One is through academic journals, such as the JAMA network journals, but also through our policy, participation in policy institutions, like, for example, the UCLA Latino Policy and Politics Institute, where we try to bring up-to-date information that sometimes is not as fast to be able to get through a peer review process in a journal, but that we can ultimately see some of the most immediate consequences of potential policies. So I think that both, by trying to get informed through the academic literature, the great literature that is most of this output from policy organizations and community organizations that produce research in this area, I think would be a way where providers can definitely get informed. And also from this organization that could potentially put together updates through newsletters to inform providers about upcoming policy changes and the potential consequences in their own policy environments at the state and local level.
I'll bring this question up from the chat for either of you or both of you. If you could recommend one advocacy step for clinicians and community leaders to protect respiratory health in underserved communities, what would it be?
I think advocacy starts with your individual relationships with your patients. And I think that part of it is informing ourselves so that we have the best data, which is very challenging with the issues with our CDC and causing more hesitancy by the policy changes that they've had. So I think it's upon us as clinicians to be up to date with the vaccines. And it's actually pretty overwhelming, especially as a family physician. I mean, obviously, as a pediatrician, there's a huge array of vaccines. The Nirsevimab is the latest RSV vaccine that we have. We should be up to date on the recommendations and make sure that we provide that information for our patients. And so I think for family physicians, it's even more challenging in many ways, right? Because we take care of patients who are pregnant, patients who are elderly, adult patients, and our pediatric patients. So there's a lot more information, but it's part of our role to really have the up-to-date evidence and be able to feel confident when we are recommending these vaccines. So I think that's part of the big advocacy is doing your homework, being prepared. And then I think the second step is locally through your chapters. I think being a voice, and as you said, Dr. Oliveira, about talking about these stories, how they're affecting us, how they're affecting our families, our patients, so that the policymakers understand the negative consequences when these policy changes are enforced. I think that really needs to be represented, which can be very challenging because we are, it's a tightrope of kind of walking the line of not wanting to be political, but at the same time, you're also, you're worried about budget cuts and you don't want to be out there pushing too much so there's a target on your back, right? And I think we still need to advocate for our patients, but do it in a way that's strategic and kind of effective as well.
Yeah, I think as physicians, as clinicians, as people in the, health sphere, we're nerds and we love to read and we love to know and have knowledge. And like you said, we like to stay up to date. So really making sure we are staying up to date, both in the science, but also in what people are hearing out there, I think is also key. So also engaging in social media and seeing what are people hearing. So then when they come with the question, you've already thought about it and have some insight. I wanted to thank all of you for those thoughtful questions, and thank you to our speakers for sharing your expertise and perspectives. This dialogue is exactly what we need to prepare our communities for the respiratory illness season ahead. And so I want to ask everyone to join NHMA and become a vaccine champion with the National Hispanic Medical Association. Vaccine champions are trusted messengers who help share culturally relevant, evidence-based vaccine education in their communities. As a champion myself, but as a champion, you'll be among the first to receive NHMA's bilingual vaccine materials that were mentioned and asked about during this talk, and you'll play a key role in getting accurate information into clinics, schools, community events, and online spaces. So you have that QR code, like Dr. Isea mentioned, that's the way of life now. And if you haven't already, I encourage you to sign up today, and please make sure this opportunity, share this opportunity with your network of people who weren't able to come in today. We'll also be hosting our second Salud+Policy Town Hall in January 2026 to close out respiratory illness season. More information will be shared in the coming months, and we hope to see you there. We hope to see you at NHMA's next event, including the September webinar focused on empowering community health workers in HIV prevention and care. And lastly, I'd like to share also, we mentioned those bilingual resources. I'd like to highlight those developed by NHMA and reviewed by our National Immunization Advisory Committee. These materials are designed to make vaccine education clear, accessible, and culturally relevant. They include a vaccine schedule by age for children, adolescents, and adults, easy to read RSV information, and most importantly, a myth versus fact guidance to address common vaccine misinformation that's out there. We'll be sending these resources to all the attendees after today's event, so don't be scared, you're not missing out anything. Please share them with your patients, your colleagues, and your network so that we collectively can increase vaccine confidence and uptake in the Latino community. And then a little bit of information into empowering Hispanic and Latino health. For more information and resources, please visit hispanichealth.info. And I'd like to also strongly recommend, I have been an NHMA member since I was a pre-med, that's a while. We want you to join NHMA today and connect with healthcare professionals working to improve health outcome for Hispanic and Latino communities. Scan this QR code to become a part of our mission-driven network. I'd also like to mention the next slide of we are trying to highlight a valuable resource that NHMA has, which is our job board. Whether you're seeking your next career move or looking to recruit top talent, this platform connects job seekers with over 400 active employers and features more than 13,500 job postings. For employers, it provides access to over 19,000 searchable resumes and more than 3 million total profile views. Simply scan this QR code on your screen or visit our website to explore opportunities to connect with others in our network. And lastly, again, I'd like to thank everyone for joining us today. This was a great talk. I learned a lot, and I really enjoyed the conversation. Any question that we didn't answer, we will respond to you after the chat. And I really appreciate everyone's time and expertise.